Great. Thank you so much, Celie. And thanks to you and Justin for creating this space so that we can share important public health updates. I also wanted to thank the interpreters for providing language access so that we can get this messaging out to a broader landscape of our community. So I'm going to share my slides here. Just bear with me. All right. Hopefully you can see that.
Yep.
Well,
It's coming through.
all right, great. So good afternoon, everyone. My name is Eric Chow. I am the Chief of Communicable Disease, Epidemiology, and Immunizations here at Public Health Seattle King County. I am an adult doctor, a pediatrician, and an infectious disease specialist. And I have the great privilege of working with a really passionate team that oversees infectious diseases and immunization strategies for King County. And in today's presentations, I will be providing important infectious disease updates, including what's going on with respiratory illnesses as we head into the 2024-2025 season, as well as updates for other infectious diseases, as you heard Celie mentioned earlier. So I hope you all are able to stay until the very end. I hope to leave some time for questions. So without further ado, let's go ahead and get started. So in today's presentation, we'll start off by exploring what's been happening with respiratory illnesses, specifically what's been going on with flu, RSV, and COVID-19 here in King County. And I'd like to also spend some moments talking about why we continue to be concerned about these infections, how they continue to cause health impacts, including complications like long COVID. And of course, we will also be reviewing how we can all keep ourselves and our loved ones safe from these health complications associated with viral infections by also reviewing some of the respiratory virus vaccine recommendations that have been updated for the 2024-2025 season. And I've actually received quite a few questions about how vaccines work, or at least how we expect them to work. So, and which really gets at the core of how vaccines train our bodies to fight off infections to prevent severe complications and health impacts like long COVID. So I'd like to spend a few moments talking about some of those vaccine principles. And then lastly, we'll end on updates on dengue and mpox infections, which I know many people have asked about because they've been in news headlines recently because infections have increased globally. So what's been going on with respiratory illnesses? Well, here at King County, we continue to track the big three, so COVID, flu, and RSV. These are viruses that we know have continued to cause a lot of health complications in our communities, disproportionately impacting communities that have experienced inequities in care, and also people who are at higher risk for these complications. And it's really important for us to know what is going on so that we can tell all of you what steps that you can take to protect yourself and your loved ones from severe complications. But how we track respiratory illnesses has changed over time. And I know many of you are very aware that early in the pandemic, we were closely following COVID-19 cases. But over time, for a number of different reasons, COVID-19 cases is not the best way for us to know how much COVID is actually circulating in our communities. And this is for the following reasons. Over time, fewer people have chosen to test. And this could be because, someone has the symptoms of COVID and they're no longer concerned about whether they have COVID or some other infection. They choose not to test. Sometimes it's because they don't have access to a test, or maybe they went to a doctor's office and their doctor chose not to test. And for this reason, the number of people who actually get reported to us as having COVID-19 is probably far less than actually what's happening in the community. The other point that factors into why cases aren't as accurate as before is because we have home testing. So even those people who choose to test, they'll use a home test kit to avoid having to go to a doctor's office. And if they test positive, that test result doesn't actually come to us here in public health, so we wouldn't know about it. So another reason why tracking cases alone is not the best way for us to know what is going on with COVID-19 in King County. Similarly, we had previously referenced hospitalizations for COVID-19 as a way to know how COVID-19 has been affecting our communities. But over the last year, CDC had no longer required hospitals to report this information to us. So that is currently not the most accurate way for us to assess how COVID is circulating in our communities. However, we do hope that we will be able to offer this data in the future. So how do we know what's happening in King County? I do encourage folks on the call to reference our respiratory illness dashboard, where we show a lot of this information that we use here at King County to know whether COVID, flu, and RSV are causing more infections in our county. So there are several metrics that we use. The first one that I usually like to go to is looking at emergency department visits, specifically why people are going to the emergency department. Now, what we know over the course of the pandemic is that during times when we see more COVID, more people show up to the emergency room with a COVID diagnosis. And so we can track these numbers over time and see how they change. So it will alert us when we are seeing periods where there's more infections than there are in other periods. And the same goes for flu and RSV. Now, other metrics that we can use to track what is going on in our communities includes laboratory testing results. So when you go to a doctor's office, if a doctor chooses to test you for respiratory viruses, this data then gets uploaded and comes through public health. And during periods where there's more infections in the community, we see higher numbers of positive tests. And so we calculate a percent positivity, which gives us a pretty good indication that whether there are periods of higher infection than other periods. And you can see that in this figure. Now, another metric that we look at, which some of you may be familiar with, is wastewater data. Now, this is a relatively new way for us to be able to track infections by measuring the concentrations of infections in our wastewater. Now, over time, we have seen that when there's more COVID in our communities, the wastewater concentrations also increase. I do caution, though, because this is a pretty new way for us to be able to track infections. And just because concentrations are increasing doesn't necessarily translate into more cases, because some people may shed more virus than other people. Now, what's been happening with flu and RSV over the last year? Well, flu and RSV behaved actually in a very predictable way that we had seen before the pandemic. Over the course of the year, we started to see increases in flu and RSV beginning in the fall around October and November. We started to see this continue to increase into the winter, around the time when people are traveling and spending time with family and friends. So we had spent a lot of time making sure that people were aware that flu and RSV were causing a lot of infections, and people should take steps to make sure that they were protecting themselves and their loved ones from infection. Now, COVID also had an increase during the winter time, but it also had an increase during the summertime. And you can see that reflected here in the winter and here in the summer. Now, we saw increases in COVID during the summer across our different metrics. So I mentioned before, we look at testing positivity, and you can see that increase here by the red arrow. And we also saw increases in the wastewater surveillance, and you can see that in the circle. And the summer increase was particularly problematic because I think most of us don't usually associate the summer with having respiratory infections or respiratory illnesses. So this is during a time when people are expecting to go lay on a beach or travel and visit family, spend time outdoors. But the last thing on their mind typically is a respiratory infection. But COVID, unfortunately, has changed that. It has really prompted us to really think about making sure we're taking precautions to protect ourselves and our loved ones during a time of year when before the pandemic, we didn't have to worry much about respiratory illnesses. So when you think about sunshine now, we also have to think about protecting ourselves from COVID. Now, over the last year, COVID has done things that we've known it to do throughout the course of the pandemic, and that includes producing new variants. So COVID has this amazing ability to be able to produce new mutations or changes on the virus that allows it to infect people more easily and then spread in the community, even though so many of us have either had infection before or been vaccinated previously. And this is why it's so important for us to keep up to date with the new vaccinations which target these new variants. So how have we been doing with vaccinations here in King County? So this summary looking at the percent of our county's residents who received last year's COVID vaccine shows that unfortunately, our numbers aren't as high as we'd like to see them. Only 29% of King County residents received one dose of the 2023-2024 updated vaccine. This is a number that I really wish could be much higher. To give you a comparison, in the previous year, 37% of our county residents were vaccinated with the updated vaccine, which in my opinion is still pretty low. But each year we're starting to see decreases, which is very concerning. So we need to take steps to make sure that people are up to date with the recommended vaccinations. And when you further look at the data by age, we see that younger people have lower vaccination rates. And we also see disparities by race and ethnicity, with Black and African American communities, as well as Hispanic communities, having the lowest vaccination rates in our county. And I talk a lot about vaccination, even at this point in the pandemic, because I continue to have concerns about the health impacts of COVID-19, particularly long COVID. So I'd like to spend a few moments talking about that. So people think, well, you know, respiratory illness at this point is much more mild than it was at the start of the pandemic. And while that might be true, I want to give you a point of comparison. Now, before COVID-19 arrived, below the red arrow, we considered this level of respiratory illness hospitalizations to be really severe. So that box in gray. Now, in the last year, this is where our hospitalizations are with COVID, flu, and RSV, which far exceeds where we were previous to the pandemic during seasons where that we considered severe. So it's important to note that now with COVID-19, we are seeing much more severe hospitalization levels than we had ever had before. And this is one of the many reasons why we are still concerned about COVID, flu, and RSV. A lot of research has gone into assessing how is COVID compared to flu when it comes to mortality or deaths. And this important paper that was published earlier this year shows that COVID-19 remains more deadly than the flu. And we see some of these death counts also reflected over the summer. Now, over the summer, the CDC reports that there's been over 700 deaths each week due to COVID-19, which is roughly twice the number of deaths that we have seen in the spring. So with this current wave, we are definitely seeing more mortality associated with COVID-19.
Hey, Dr. Chow, real quick, are you taking questions at the end, or do you want me to
Yeah,
raise my hand?
I can take questions at the end, Sealy.
Okay, yep, all right,
That's
perfect.
okay. Yeah, thank you. I want to spend a few moments talking about long COVID too. So some of you may know that long COVID is a complication that we've been seeing in people with prior COVID-19 infection. We know that up to 10% of people who had COVID previously will go on to develop long COVID. And what is long COVID? Well, long COVID is actually associated with over 200 signs, symptoms, and conditions. Some common symptoms that people experience are extreme fatigue. So you may have been a healthy athlete before getting COVID. And then after COVID-19, some people will be so debilitated that they would not be able to get out of bed or go to work. Some of these symptoms are shown here. Long COVID can impact your ability to do your normal activities. And in fact, some new statistics that I have here that I'd like to share. It is estimated that about 5% of US adults have been affected by long COVID. I think that's a really stark number that is important to highlight to showcase why we continue to be concerned about COVID-19. More than 1 million people in the US have been put out of the labor force, haven't been able to go to work because of long COVID symptoms. And more than 3.6 million people have experienced long COVID and been affected by long COVID to the point where they haven't been able to do their daily activities. In addition, I think it's important that to acknowledge that long COVID also includes other health impacts like diabetes, heart disease, and cognitive impairment, meaning that before your diagnosis of COVID, you may have been perfectly healthy, but after your infection, some people have gone on to develop diabetes, have heart disease, and have difficulty thinking or processing information, such as doing simple math in their head. Long COVID can affect people of all ages, even if the person had asymptomatic or mild infection. And it's important to note that children can also develop long COVID. Although their risk is lower than adults, it does increase with age. And this is why we try to emphasize that stopping infection from happening in the first place is really critical. While vaccination is important, making sure that you're wearing a well-fitting, high-quality mask, improving ventilations, and just taking precautions, everyday precautions, will help you reduce your risk of COVID and long COVID. So speaking of vaccinations, I'd like to spend a few moments talking about the updated recommendations for respiratory virus vaccines for the upcoming season. So many of you may already be aware, we will have or currently have vaccines and immunizations against COVID, flu, and RSV. So let's spend some time with each of these infections. The updated 2024-2025 COVID-19 vaccine is recommended for everyone 6 months and older. So even if you've had COVID vaccines or boosters in the past, CDC continues to recommend that everyone get up to date by receiving at least one dose of the 2024-2025 COVID-19 vaccine. And if you take a look at some of your local pharmacy websites, you can many places are now accepting appointment reservations. So you should go ahead and check to get your vaccine appointment scheduled now. This updated vaccine is an updated formulation that targets the more recent COVID-19 variants to provide you that additional protection against severe disease, as well as protection against long COVID. And it's important to note that COVID-19 vaccine is not intended to prevent infection, but it will protect your ability or protect you from developing complications associated with COVID-19. So perhaps your symptoms will be less severe. It will protect you from having to go to the hospital and will protect you from dying as a result of COVID-19. For flu, the annual flu vaccine is recommended for everyone 6 months and older. So there is a new flu vaccine that is, I believe, also available right now through pharmacies. It targets 3 different flu strains. Similar to COVID, it is not expected to prevent infection, but it will reduce your risk of severe illness and death, especially for those people who are at high risk. And since last year, we've had a new RSV immunizations, which are now recommended for infants, pregnant people, and older adults. Now, for infants, infants less than 8 months during the respiratory illness season, they're recommended to get the immunization. For children 8 to 19 months who are at high risk, such as those people with chronic lung disease, they're also recommended to get the RSV immunization. Pregnant people also have an RSV immunization that's available to them that is recommended at 32 to 36 weeks of pregnancy during the respiratory illness season from September through January. And contrary to other vaccines, which usually protects the individual who is receiving the vaccine for pregnant people is actually intended to protect the baby, who typically would be too young to receive other vaccinations. So when mom gets the vaccine, it produces antibodies, and that antibody defense is really important for the baby once they're born, if they were ever exposed to RSV infection. And then lastly, we also have an RSV vaccine for older adults. And this is available for individuals who are 60 to 74 years with increased risks, such as those people with severe immunocompromising disorders, and all people 75 years and older. If you received the RSV vaccine as a pregnant person or an older adult in the past, you don't need another dose this year. So again, just to emphasize, we have actually two vaccines or two immunizations, one for infants and one for pregnant people. Both are intended to protect young babies. So I know many people on the call are thinking, well, I don't usually think about vaccines in the context of individual respiratory viruses. So what's recommended for me? So which respiratory virus vaccines should adults get? So adults should be getting an updated COVID-19 vaccine, even if they had prior vaccines or boosters. They should be getting an annual flu vaccine. For adults 75 years and older, they should get an RSV vaccine if they've never been previously vaccinated against RSV. Adults 60 to 74 who are at higher risk of RSV complications should get the RSV vaccine. And of course, it's an important reminder that if you're going to be getting all these other vaccines, talking to your doctor about other vaccines that are recommended for you based on your age and underlying conditions is also very important at this time. And it's a great way to be able to get caught up with all the things that, all the vaccines that could protect against infections. So what respiratory virus vaccines should children get? So for children 6 months and older, they should receive the updated COVID-19 vaccine, even if they've had prior vaccines or boosters, as well as the annual flu vaccine. For children less than 8 months during the season, they should receive the RSV immunization if their mom was not already vaccinated. And of course, for children 8 to 19 months who are high risk during the season, they should receive the RSV immunization. And of course, there are a number of childhood vaccines that children should receive. So talking to your doctor about what else is recommended for your child is really important. Now, most people may not be thinking about vaccines during pregnancy, but you really should be, because pregnancy infections can cause a lot of complications during pregnancy. So here I talk about what respiratory virus vaccines pregnant family members should get. So pregnant family members should make sure that they're up to date with the recommended COVID-19 vaccine. So even if they receive prior vaccines or boosters, they should receive the updated vaccine for this year. They should also receive the annual flu vaccine, and they should also receive the RSV vaccination to protect their baby at 32 to 36 weeks of pregnancy. Now, if you received the RSV vaccine last year because you were pregnant last year, you don't need another dose at this time. But it is important to have your child immunized to protect them against RSV this season. Also, make sure to talk to your doctor about other vaccines that are recommended for you during pregnancy. I think one important one that we're trying to make sure that people are aware of is Tdap, which actually protects against whooping cough, which has been spreading quite a bit in our communities. Now, we talked a lot about vaccines. Now I'd like to talk a little bit about how vaccines work. How do they train our body to protect ourselves, to protect us from severe disease and complications because of we've been exposed to a virus? Well, our body relies on our immune system to keep us alive against infections. If we didn't have an immune system, we got an infection, many of us would get seriously ill and would likely die as a result of those infections. But fortunately, most of us have a healthy immune system that consists of antibodies and immune cells. Now, viruses cannot survive on their own. That's why they have to infect people to reproduce and transmit to other people. When a virus gets into your body, it infects a cell, introduces its DNA, and tells the cell to start producing more virus. And in doing so, it destroys that cell and then allows more virus to go destroy other cells. And that's what makes people sick. So your immune cells float through your blood system, trying to track down any type of infection that may be floating around, trying to stop it from causing you to be too sick. And so when infection, again, this is another depiction of how an infection affects your body. So when your infection enters the body, and that could be through many different ways. For respiratory viruses, this is usually through your nose and into your lungs. The virus starts to replicate. Your immune system knows that an infection is there, so it starts to boost up its resources to defend against this infection. And then over time, the immune system should be able to stop the infection from progressing any further. It's much better if your immune system has the necessary tools it needs even before the infection arrives, so that it can stop the infection from progressing too far. It is important to note that as your body is fighting off infection, as your immune system is trying to stop the infection from multiplying too far, you may experience symptoms. So that's why many of us will develop fevers. We may feel unwell. We feel very tired. We have headaches. This is our immune system kind of revving up, trying to fend off this infection. It is important to note that the immune system itself learns each time an infection occurs. And then the immune system improves its defenses against infections by learning about the disease. But actually, you don't have to wait until you get an infection for your immune system to learn something. This is why we have vaccines. Vaccines actually provide a safe way for our bodies to learn about infection without the risk of infection. So sometimes you give part of a virus so that the virus can't replicate. And then your immune system uses that as a tool to educate itself so that the next time it does see the virus in real life, it can actually fight it off before it causes too much damage. But of course, vaccines may require additional doses over time. As I mentioned before, COVID has this great ability to be able to mutate and change the way it looks. So it tricks the immune system into thinking it's something different because the immune system hasn't seen it before. That's why we need updated vaccines every year that really targets what's circulating in the community right now. Now, a lot of people have asked about how mRNA vaccines protect us against COVID-19. And I think it's important to detail how that's different in the context of vaccines. So a little bit of background again. So remember that the virus that causes COVID-19 has a specific protein called a spike protein, which it uses as a key to essentially let itself into your body, into your cells, and then multiply. So this key is an important target area to make sure that your body knows to block it from producing more infection in your body. So COVID-19 vaccines teach the immune system to block the virus from causing an infection by targeting the spike protein. So it produces more antibodies and more cells that recognize the spike protein on the COVID-19 virus. Now, the COVID-19 vaccine itself contains mRNA. These are like little messages or blueprints that the body can use to be able to train its immune system to be able to fight off COVID-19. The blueprint tells the body how to produce a protein that looks like the spike protein so that it can start learning its shape and the way it might affect the body. So the antibodies are then able to make changes to itself to attack the virus anytime it were to enter the body after the vaccine. And so again, the cell uses this blueprint, the mRNA, to be able to make the protein without the risk of making a live virus that then could replicate. Again, the immune system learns the shape of the spike protein and then blocks the virus from replicating in the future. But however, if the virus changes or mutates the shape of its protein, such as the spike protein, our antibodies have a harder time blocking the virus. So you can think about a situation in which you might have a COVID-19 exposure. So if you're having a gathering of people and someone had COVID-19 and sneeze or cough, a bunch of viral particles would be floating in the air. And so your body would be exposed to that. And a lot of viral particles are likely to be expelled, and you might be exposed to that. So once the virus gets into your body, your antibodies will start to defend against the virus. However, usually there's more virus than the antibodies are able to overcome. So some people may still develop symptoms because of the infection, but because the antibodies help give the immune system a leg up on defending itself against COVID, the learned aspects from the vaccine can actually prevent you from getting severe disease, and in some cases also prevent you from getting long COVID down the road. So COVID-19 keeps evolving, so this is why we need to stay up to date with recommended vaccinations. The new vaccines target our more recent variants, just like this updated 2024-2025 COVID-19 vaccine will target the more recent Omicron variants that we have seen. It will give the immune system also a refresher course on how to protect itself against COVID-19 and defend against complications associated with the infection. It may also, although we might still get an infection, we are far less likely to get hospitalized or get a complication, die, or get long COVID when we do get an infection. And remember, preventing infection in the first place requires other precautions as well, such as masking. So when we talk about layered approaches, additional defenses in preventing infection from the first place, it is important to recognize that vaccines alone isn't going to be able to protect us against all infections. So wearing a well-fitting, high-quality mask, making sure that when you're indoors and in crowded spaces, that you try to improve ventilation, that will help decrease your risk of exposure. And I know that despite our best intentions at preventing infection, some people may still get sick. Especially for higher risk people, getting tested early and getting treatment early is going to help decrease our risk of complications like hospitalizations and death. And these collectively provide our defenses against viruses in many ways, like the Swiss cheese model. So I know many of you may be familiar with this analogy, but by having a number of different layers in place to protect against viral infections, we hope that each layer will provide additional risk protection against infection. So you can think about each of these layers as a different intervention you have taken, just like masking, ventilation, and vaccine. So the more precautions that you take, the less risk that you have for infection and severe disease. So I talked a lot about respiratory illnesses now. I know that another thing that has been on people's minds has been dengue. And I want to spend a few moments talking about dengue. So what is dengue? Some people refer to dengue as breakbone fever. Well, this is a virus that actually is transmitted to people from mosquitoes. It's not transmitted from person to person. It can have flu-like symptoms such as fevers, aches and pains, nausea and vomiting associated with the infection. Some people actually have no symptoms. They didn't even know that they were infected. However, each time you get another dengue infection, you have increased risk for severe disease. And some people do have to get hospitalized as a result of dengue infection. This is why it's been talked about so much in newspapers recently. Now, people can get dengue several times over their life. And it's important to note that 400 million people are infected with dengue globally every year. But dengue is not as much of a concern here locally. Dengue is typically found in tropical and subtropical climates. So usually around countries around the equator is where you would typically see this type of infection, because that's also where the mosquito that transmits dengue lives. But dengue can be found in the US. So, 6 US territories and associated states do experience dengue infections around the year. So, recently, Puerto Rico in particular has experienced a large dengue outbreak. So, people who are traveling there, it is always recommended to take precautions to protect yourself against mosquito bites, to protect against dengue and a lot of other mosquito-related viral infections. Dengue has also been seen in certain states where outbreaks have been reported, such as Florida, Texas, Hawaii, Arizona, and California. Most cases in the US, though, dengue cases are travel associated, meaning people travel to a place where there's a lot of dengue, and then when they return home, when they're diagnosed, those are the situations that we hear about, certainly here in Washington. So why has this been such an issue of recent? It's been in news headlines. People have been talking about dengue quite a bit. Well, in 2024, we've had about 3,000 dengue cases reported so far. Most of these were actually acquired in Florida, Puerto Rico, and the US Virgin Islands, in places where historically there's been circulation of dengue throughout the year. All other cases were associated with travel internationally, so outside of the US. Some people were asking about, well, what about Washington State? Well, in Washington, we do get reports of dengue, but these are oftentimes cases associated with travel, as I mentioned before. So here in King County, between 2014 to 2024, all cases, except for 2, have been acquired outside of the United States. Now, the 2 that were acquired within the United States were actually acquired when Hawaii experienced an outbreak in 2016. So far in 2024, King County has reported 11 cases so far, and all of these have been acquired outside of the United States. Fortunately for us, at least right now, King County, Washington is outside of the range of Aedes mosquito species. So this is the specific mosquito species that transmits dengue. I want to show you a map because I think it's important context for why we are continuing to track dengue and Aedes mosquitoes so closely. Now, here in blue and in green, you can see the normal distribution of Aedes mosquitoes. So where Aedes mosquitoes are is possibly also where dengue is. So far, in Washington, you can see that it's color-coded in lighter colors because it is less likely to be an area where Aedes mosquitoes would live. However, as our climate starts to warm up, it is possible that Aedes mosquitoes will start to move northward, and so would certainly increase our risk for dengue. But at least as of right now, we do not have any reports of Aedes mosquitoes here in this area, and we also don't have reports of dengue acquired in this area. So you may be thinking about, well, I'm still concerned about dengue because I have family members who live in Puerto Rico, for example, and I travel there pretty frequently. So how do I prevent infection from dengue? Well, first of all, you should take steps to make sure that you reduce your risk of mosquito bites. So this includes wearing bug repellent and also wearing loose-fitting long-sleeve pants and shirts to help deter mosquitoes from biting you. You also want to take steps to control mosquitoes indoors and outdoors. So indoors, you can use air conditioning, using window screens to prevent them from entering the house in the first place. Also outdoors, if you see any freestanding water, this is where mosquitoes like to breed. Dump that water out to prevent mosquitoes from laying eggs there and also multiplying in your area. If you have symptoms of dengue and have been in a place with dengue, you should make sure to seek medical care early so you can get treatment early. And then also it's important to note that mosquitoes get dengue virus by biting people with infection. So we don't want people to travel to a place where there is dengue, get dengue, come back and have one of our local mosquitoes bite you and then transmit dengue. So even when you return from a place where there was previously where there was dengue, you want to make sure to continue to protect yourself from getting mosquito bites because it will help reduce the chance that mosquitoes here locally will start acquiring dengue. All right, I talked about dengue. Now I want to give you an update on Mpox because this has also been talked a lot about in the newspapers recently. So just as a reminder, Mpox is formerly known as monkeypox, is a viral disease that can spread from person to person. And as you recall, in 2022, there was a large global outbreak of Mpox that occurred that affected many countries outside of Africa, where Mpox previously came from. This has disproportionately impacted people who identify as men who have sex with men or transgender individuals and other people who have sex with men who have sex with men. Transmission was most frequently occurring during close or intimate contact with people who are infected. And infection, it was important to note that infection could also occur when direct contact with someone with the rash. Fortunately, over time, we have seen a decrease in Mpox cases here in the US. In 2020, this is a graph showing the cases in the US over time. You can see that over the last few months, there's been a decrease. However, it is important to note that Mpox cases are still being reported, particularly among the high-risk communities. Here's some data from King County specifically. We have seen far fewer cases recently than we certainly saw in 2022 at the height of the outbreak. But we still need to take efforts to make sure our community is protected by staying up to date with the recommended vaccines. Now, what has made headlines recently? Well, on August 14, 2024, the WHO declared Mpox outbreak a public health emergency of international concern once again because of a large outbreak that was occurring in the Democratic Republic of the Congo. And we know that if any country is experiencing a large outbreak, it is quite possible that those infections can spread rapidly around the world. And the WHO made this declaration because there was a lot of spillover of cases into surrounding countries. So in DRC, since January 2023, there's been more than 27,000 suspected Mpox cases that were reported with 1,300 deaths. And this is a huge issue in the country, and they've been working to try to contain it. And part of the reason why the WHO made this declaration is to increase resources that will be made available to these countries to help control infections. But we are very concerned about the potential for spillover of these cases into other countries. So for example, the type of Mpox that is in DRC right now has been detected now in Sweden and Thailand. Fortunately, this new type of Mpox, which we haven't yet seen here in the US, hasn't been detected in the US so far. But it is an important reminder that people who are known to be high risk are recommended to stay up to date with their recommended vaccinations for Mpox. So who are the high-risk people? So these are people who self-identify as gay, bisexual, men who have sex with men, or transgender people who had recent sexually transmitted infections, who have multiple partners, who have sex at commercial sex venues, sex at large public events. If you're planning on traveling to places where there are current Mpox outbreaks, but you are not a high-risk individual, you do not require the vaccine. But for those people who are high risk, it is important to note that the best protection is getting 2 doses of the vaccine. So if you happen to got your first vaccine back in 2022, you can get your second dose now. You don't require any boosters at this time. So I spend a lot of time going over a lot of important public health updates, talking about respiratory illnesses and also providing you some important updates about vaccinations for this upcoming season. Spent some time talking about how vaccinations work, and also providing you some updates on dengue and Mpox. Hopefully this information was really useful. I am happy to take any questions that y'all may have. And thank you very much.
Perfect. That was actually beautiful, Dr. Chow. I learned a lot there too. Um, yeah, we had a bunch of questions. I'm actually going to call on some of these people too to like elaborate on the questions because I know some of them happened like real time as well. But the first one was from Fox. Why why was it so low in April and May area? I think this was earlier on in your presentation.
I
Yeah.
think oh, sorry, go ahead. Did
I was
someone
gonna
just
say it was the COVID graph that you were showing about the summer wave, showing that, no, the other one, I think it was back.
Yeah, let me pull that back up for you.
Yeah. So you see that kind of like valley.
Yep.
I'm curious about why that might be.
Oh, you mean like why there was this period of time where there were far fewer COVID-19 levels?
Yes.
Yeah. It's hard to say. I think one of the things that's really important to note about COVID-19, the one thing that is predictable about COVID-19 is its unpredictability. And there could be a number of reasons for that. It could be that because we're now out of the winter season, and fewer people are going to be indoors, maybe more people got vaccinated at the time, any number of reasons. But this is also around the time when new variants were starting to emerge. And so I do worry that part of the reason why we start to see a summer wave is related to the fact that COVID managed to develop new mutations that kind of evade our immune system and then contributed to kind of what we saw later on in the summer. Hopefully that's helpful.
Yes, thank you.
Perfect. The next question is from Tara. Are there organizations that are providing free COVID testing materials for low-income families and individuals?
Yeah, I will say that the federal government recently announced that at the end of September, they are once again going to be offering their free COVID vaccine program. So each household will be able to order, I believe, up to 4 COVID tests. And we can look for that link for people so you can keep an eye out for when to order. But the reality is that COVID-19 funding from the federal government has decreased quite a bit since the height of the pandemic and has limited the ability to get COVID tests out to folks. But I am glad that there is this opportunity once again through the federal government to order COVID-19 tests. Again, hopefully that will be available soon.
I see a hand up. Well, we'll go to the hand. Napier? Well, as they're looking for the mute button, I am going to keep going down these list of questions. What was the
Yeah,
triple pandemic?
so sorry
Oh,
about that.
oh, you're good. Good. Go ahead.
Yeah.
Go ahead.
I wanted to apologize. Sorry, I was fumbling there. My question was going back to kind of the first question, and I'm so glad the graph is still up. So I'm asking this question because I personally got COVID for the first time last year, Labor Day, and I waited the 90 days to get revaccinated. For some reference, I had had all my vaccines and boosters up until that point. And then 11 months to the day, I got COVID again. So I got COVID at the beginning of this month on the
Oh,
4th. And so your comment about the mutation, you were circling kind of around May, that you feel like maybe those cases started to go down because people were being vaccinated, but you felt like the strain had mutated. So for someone like me who has a lot of concerns about getting COVID twice in 11 months, never having it before then, it has just been like a really bad head cold, but the COVID fog that follows is awful. So I'm wondering if you recommend if we wait then for a vaccine until that time. Are you guys developing a new mRNA around that time, looking at it mutating? So I don't know if that's a very direct question, but I feel like I've gotten it twice around the same time and I've kept up to date on my vaccines. So should we wait to get vaccinated a little bit longer, like in the spring?
Yeah, thanks for that question. And I think your experience kind of really resonates with me, and certainly a lot of the experiences that other people have had with COVID. I think COVID has shown its ability once again to mutate and evade our immune system, but our best protection remains the COVID-19 vaccination. So I'll start off by saying that this is the reason why we had an updated vaccine that's available now. The 2024-2025 COVID-19 vaccine. So even if you received vaccines before, had boosters before, had infection before, getting up to date with this vaccine now is going to be really critical at protecting against the severe complications of COVID-19. It is important to also note that the vaccine itself, by itself, will not protect against all infections. So if you're looking to prevent any type of infections, you'll have to get the COVID-19 vaccine, plus take those other precautions that I'm talking about. So that includes wearing a well-fitting, high-quality mask, particularly when you're indoors and public spaces. I certainly remind people when they're traveling, airports, airplanes are a really important place to wear a mask. And I go everywhere with my mask. When you're indoors and in crowded areas where you have the ability to improve ventilation, that is an important way to reduce the concentration in your subsequent exposure to the virus that causes COVID-19. Now, I think the one thing that COVID has continued to show is that it will probably continue to mutate, as we have seen, and we'll likely continue to see these cycles. So even if you've had COVID infections previously, taking these extra precautions is going to be really critical, especially when you're trying to avoid some of the complications that you were saying. The cognitive fog is a huge issue. Many of us who have had infections know what that's like, and we certainly don't want to ever experience that again. So that's why taking the vaccine now, because right now, as you can see at the very end of this graph, we're still seeing pretty high levels right now at the tail end, right? And now we're about to head into the respiratory illness season. Getting that vaccine now will provide us that extra boost, but also taking those other precautions. The masking piece, I can't emphasize it enough. That's a really core part of protecting us from getting infection in the first place.
Thank you very much.
Perfect. The next question is, what was the triple demic?
Yeah.
Yep.
Yeah, thanks for bringing that question up. It's something that I hope we never have to really experience again. So the triple demic is a term that references the respiratory illness season that we had in 2022, when we had a lot of cases of COVID, flu, and RSV happening at the same time that overwhelmed our hospital system. So many people were getting sick. So many young children were getting sick and hospitalized to the point where hospitals had trouble taking care of all the patients who had respiratory illness. And that's something that I always continue to be worried about. This is why we continue to try to promote these important messages, staying up to date with your recommended vaccinations, taking precautions, for not just for high-risk individuals, young people, old people, even if you're previously healthy. Remember, flu and COVID-19 vaccines are recommended for all individuals 6 months and older. So taking precautions like that will help reduce our chances of having another season like 2022, when we saw all three of those viruses causing severe infection.
Perfect. Going down the list, can you please talk more about infection in the water?
Infection in the water. Yes, wastewater. Absolutely. I don't know if there's a specific question there, but I believe the question specifically is referring to wastewater surveillance data. So, like I mentioned before, wastewater surveillance is a new way for us to be able to track infections that are happening in our county. So, infections such as the virus that causes COVID-19, or here is listed as SARS-CoV-2, we know that when people have an infection, they actually have virus shed in their stool and other things that people kind of toss into the wastewater. And you can actually measure the concentration of virus in the water to see what is happening in terms of COVID-19 activity in your county. So as you can see here, these three locations named Brightwater, South, and West these are referencing different wastewater treatment plants. You can see concentrations of COVID changing over time. And towards the end of that graph, you can see increases, which coincides with what we know happened or is currently happening here during the summer. We saw increased activity. So this is a novel way for us to be able to track what infections are doing in our county.
Perfect.
I
I
have
see that
I have a following question. Thank you, Silly. Thank you, Dr. Cho. So I
Sure.
was thinking about the people who are connected to sewer system, right? That's what we're getting. But what about septic tanks? We're not reading those, right?
Yeah, that's a great question. There are certain
Thank you.
parts of our county where most people's wastewater is only collected in septic tanks. And you're right, we wouldn't have an accurate assessment of what is happening with infection in those areas. That's why we don't rely only on wastewater, right? We look at all these different metrics. So we look at the ED visit data, we look at the test positivity, and to be able to understand what COVID and other respiratory viruses are doing in our communities.
Perfect. Also, same question. I think I know the answer, but just want to follow up.
Sure.
Will you be sharing this PowerPoint with Justin, Dr. Chow, to put into the newsletter, or how does that work?
Yeah, I'm happy to share it. Yeah, all of this is information that's from our public dashboards or available information that's gathered through CDC websites and such. So, but I'm very happy to share this information with folks.
Awesome. When you get a booster, how long does it provide immunity?
Yeah, that's a great question. I don't think anyone really knows exactly how long, but we do know that the protection over time does decrease. This is why, in part, why CDC continues to recommend a new vaccine every year to help give you the best protection. So remember, the immune system does require some training, right, to protect you against complications associated with infection. So the training, like any other type of exercise, you have to kind of provide it kind of a boost over time so that it remembers how to fight off the infection. So the vaccine, the updated vaccine every year, not only gives it the ability to learn how to protect against new viruses or new variants, but it will also remind the immune system that, hey, you know what, you need to pay attention. Anytime I get COVID, I'd like you to fight it off. So this is one way to another way that the vaccine is helpful in helping to prevent against complications associated with COVID.
Okay. Can people not in the recommended groups still get immunization? I think earlier you had talked about there's a recommended group who should get vaccinated, but this question is, can people who are not in that group still get vaccinated?
So here, let's go back
Immunization?
to some of the slides just to help with this question. I think I know what they're
Uh,
asking.
yeah, for
Yeah, go ahead.
RSV, the RSV immunity.
Oh, the RSV
Yeah.
immunization.
Okay.
Yeah. So the RSV immunization, the recommendations are really based off of protecting people who are at highest risk for complications. So we know for COVID and flu, people of all ages are at risk for complications. Whereas RSV is not quite like that. The age groups that are at highest risk for complications are very young children and older adults. That's why the CDC recommends the RSV vaccines only for those two groups of people. Again, the pregnant person receiving an RSV vaccine is specifically to protect the young child, not necessarily to protect the pregnant person, if that makes any sense. So people who don't fall under the recommended groups for RSV vaccine are not eligible to get the RSV vaccine. It's not necessary.
Okay, perfect. Can you talk about Novaflox versus Pfizer and Moderna?
Novavax, yes. So here in the United States, we have 3 vaccines that have been available over the years. So Pfizer and Moderna, people are most familiar with. These are the mRNA-based vaccines. And then Novavax, which is a protein-based vaccine. So I will say that right now, only the mRNA vaccines have received approval for people for the season. Novavax has not yet received that approval, so it's not yet available. But the main difference between the two groups of vaccines is that one is mRNA-based and another one is protein-based.
Okay.
So remember, going back to my slide about how mRNA vaccines work. So mRNA vaccines have the blueprint to have your body make the protein that then your immune system uses to train itself to protect against infection. Whereas Novavax already has that protein, and then your body learns based off of the Novavax vaccine. Both have been proven to be very effective at protecting against complications associated with COVID.
That's helpful. Can you talk about nasal sprays and CPC mouthwash, which some folks have used to prevent COVID?
Sure. So I'll say that for COVID, the most effective way to protect against complications with regards to vaccines are the mRNA or the Novavax vaccine. So throughout the pandemic, I think people have explored different ways to protect themselves because, again, we didn't know a whole lot at the beginning of the pandemic, but we certainly know a lot more now. A lot of these other steps that people have taken haven't really shown to be very effective at preventing infection from happening. Of course, the scientists who are researching this are still continuing to explore ways to protect ourselves. But the reality is our best protection in terms of vaccines are the mRNA vaccines or the Novavax vaccines. So hopefully the Novavax vaccine will also get approval soon, so people will have a choice as to what they get for the upcoming season.
Okay. This next one is just a comment from Mercedes. Dengue, surprised about Arizona since it's air raid. The next question is, can you get Mpox from surfaces? For example, a bus seat?
So the answer is it's very unlikely. So to the point where I would say no. I would say that before the Mpox outbreak in 2022, I think there was a lot of things that we didn't know about how Mpox was spreading. And what we knew about this infection before then was really from animal encounters, right? A lot of people were getting infections when they had interactions with animals that had Mpox. And so there was always this theoretical risk that you could get it from surfaces. But what has actually played out as we learn more about the Mpox outbreak since 2022 is that really it's about these high-risk encounters. It's where people have close intimate contact with another person who has the infection, especially during sexual activity. But it's also important to note that, some people, get Mpox rashes at other parts of their body. So there are circumstances where if you had contact with a rash on the hand, that is another place where infection could have spread. But the vast majority of cases were associated during sexual encounters.
Okay, and a follow-up question from that is if someone got their 2 doses back in 2022, that's it, we're up to date.
Yeah, great question. And that is right. So 2 doses, no additional vaccine boosters at this time. Actually, the 2 doses have been shown to be actually pretty effective at preventing severe complications associated with Mpox. So, but as we see new types of Mpox emerging, especially like the one that we're seeing in DRC, we are certainly looking out for any signs to suggest that maybe additional doses are needed. But this is something that CDC has to evaluate. At this time, there are no additional vaccine boosters recommended beyond the 2 doses. However,
Okay.
if you only had 1 dose, you should get your second dose now, even if your last dose was a long time ago.
Even if it was in 2022,
Even if
we
it's
get
in
it.
2022, you only need one
Okay.
additional dose.
Perfect. Next one was a question from Derek. Yeah, yes, Pastor Lane, this is recorded, and we'll send these out in the newsletter that comes out. Mohammed asked, do we have dengue awareness materials to promote in language?
I'd have to take a look to see what we have. I guess what type of dengue material were you looking for? Like travel? If it's travel related, like steps that you can take if you're traveling to a place where there is dengue, I believe CDC actually has a lot of material about how people can protect themselves against dengue. But I'd have to take a look at that.
Yeah, I can connect with Mohammed too,
Okay.
Dr. Chow, and then
Okay.
figure it out what it is and work with the comms team to help them get that material. This question is the recommendation still the same to wait 3 months after the infection to get vaccinated?
Yeah, thank you for asking that question. And that's an important piece that I think it has been on a lot of people's minds, especially since I know this during the summertime, a lot of people have had infections. So they're trying to make sure they time the vaccine appropriately so that they can get the most protection for the longest period of time. So the short of it is that the CDC continues to recommend that you can wait up to 3 months between the time you have the infection until you get the updated vaccine. Because when you get the infection, you do actually have some protection. And so you want to try to maximize that and then get the vaccine later. But of course, there are certain circumstances where people with underlying conditions, or maybe there's a situation where you may encounter that I may not be aware of that puts you at higher risk. Then maybe getting the vaccine a little bit sooner is a good idea. There's no safety concerns, but it certainly requires a discussion between you and your doctor to see if that makes sense for your situation. However, in most circumstances, you can wait 3 months from the time you had the infection until you get the vaccine.
Perfect. Someone else was really looking forward to that too, because they've heard folks getting rebound cases with the most recent variants over relatively short times or weeks. So that's all the questions I have. I'm going to throw my email into the chat box for the individual looking for tests. The program that Justin and I co-lead, we actually have access to test kits at this point, but it's for our initial community navigator program. But if you're serving the community too, we can get you some of those tests through some leftover COVID funding that we had. But I just wanted to see if there's any more questions for Dr. Chow that wasn't in the chat box. I mean, really great presentation, Dr. Chow. We got to make this thing a normal. You provide some information. I mean, I work here at Public Health, and I'm like, bro, I didn't know that, but now I know that.
Happy to
Any
help out in
questions?
any way I can. Y'all ask really important questions, and actually the types of questions that you ask also help us to develop new material to make sure that we answer frequently asked questions. I think a lot of the questions that you highlighted here have been really important.
Hi.
Any other? Oh, go ahead.
Yeah.
Go for it.
Yes, Celie. Yeah, I had a question. So this is just a clarifying question regarding the dengue fever. Thank you so much for the great information, Dr. Chow. So I just wanted to clarify one thing. So in the Washington state, so far all the cases that we've seen have been people who got the infection abroad. So there is, and there, as far as infection goes, there's no person-to-person transmission. And the mosquito, which based infection at this point does not exist in Washington state. So from that point of view, the risk is relatively low here.
Yes, thank you for amplifying that message. I appreciate that.
Thank you.
Well, perfect. If nothing else, we just thank everybody for joining the Communities Partners call. We will, process the video, send it out in the next newsletter. Again, if you have any questions, feel free to reach out to Justin or myself, and we will get that information over to Dr. Chow's team to help answer anything out. We appreciate you, Dr. Chow, and thank you to our interpreters and sign language team. So with that, I wish you a good rest of your evening. Thanks, everyone.
Bye, everyone.